The Beaumont Health System diagnoses over 5,000 new cancer cases a year. We are a 3-hospital system with a number of ambulatory facilities across southeastern Michigan. That multidisciplinary care for cancer patients is really a pillar for our institution, but really where healthcare is going from a cancer provider perspective across the country. Our head and neck cancer clinic, a multidisciplinary clinic, was really initiated back in 2011, really to look at the coordination of care for these patients.
We do deal with local, regionally advanced head and neck cancers. About 90% of them will get a PEG tube, a feeding tube, during treatment. So we thought we had a very good control over the nutritional status of these patients. When we studied about 200 patients, there was a significant rate of dehydration, malnourishment, hospitalizations due to that, and even some deaths from acute dehydration and malnourishment.
One of my special interests is treating head and neck patients with a machine called a linear accelerator. Generally, treatment takes in the range of 5 to 6 weeks. The usual site of these tumors is located in the throat region, what we call the oropharynx, because the very site of where the cancer is and the treatment is being delivered causes a reaction of the lining of that surface, making it so that there's a lot of soreness, right? And as a result, it becomes very difficult to swallow. They take less and less, food, liquid, hydration, and all the nutrition necessary for tissue repair. So to bypass this area, we encourage patients right at the outset to have a process to bypass this area. And the most common means is to put what we call a PEG tube.
We do give the patients not only the feeding tube but also the information how to use them. But it turns out there's a long time lag between that information and when the patient really needs it. When we meet them, they're well nourished, they can eat and drink, and they don't really think about these issues. When they really need them, it's about a month or a month and a half down the road. So we realized we need to get much better monitoring and much more continuous information to them. So we decided to start a nutrition clinic for every patient that goes through radiation for advanced head and neck cancer.
The key is early intervention, so we keep their weight stable, keep them strong, their quality of life, their energy, just their general well-being, and to get them through this treatment plan. So that's what the nutrition clinic has been identified and put in place to do for these patients.
The goal is to have these patients come every week during treatment, before, during, and after treatment, and see the dietitian, go through, and a nurse, and go through how to take care of the feeding tube and how to flush it with water if you're not really using it for food. And most of all, get used to it so you're not afraid of using it, because you really need it. And when you need it, it's often almost too late if you're not prepared.
Our job is to help them through the radiation therapy itself, some of the complications that occur from that.
I have a loss of appetite, and foods don't taste as well as they used to, or at all, basically. So I've lost that good feeling of good food.
Many patients are scared to use their tube. They're afraid it's going to hurt. So we instruct them on how to use it, but we also help them use it in the clinic.
No one wants to put a hole in their stomach and put a tube in, but after some convincing from my sweetheart and others, I did it, so I have it.
We show them and demonstrate to them how to bolus the tube feeding, how to flush the tube, and we show them that it doesn't hurt and it's not something that they should be scared of.
They're going to have ongoing support, care to manage this and learn how to do it when the time comes, because we're trying to prevent them from being hospitalized, emergency room visits, and we don't want any treatment breaks. We want their treatment to be smooth and consistent.
We believe in the long run this will be a standard of care for all of our patients that come through the Beaumont Health System, and at some point could lead to a standard of care throughout the entire nation for all cancer patients moving forward.